So there's a lot of talk about AI and how AI, artificial intelligence, is just changing the game. It's just changing the world and the way we think and the way we operate. With platforms such as Chat, GPT, and other forms of artificial intelligence, it brings a lot of question marks on what does our future look like when we're utilizing artificial intelligence. And it kind of got me thinking a little bit, how is the mental health space going to be impacted by artificial intelligence? So I want to share just my personal thoughts on how I feel artificial intelligence is going to change the way we practice mental health. But also, too, are these good changes that are going to be happening, or are these bad changes that are going to be happening? But we're going to talk about it right now. What's going on, y'all? It's Terrence, the therapist. Thank y'all for tapping in. Don't forget to subscribe to the channel and hit that notification bell so you know when these videos are about to drop. Now, artificial intelligence is not anything new to our society and to our world, but there has been a huge emphasis on artificial intelligence within the last couple months. So I want to break down in this video, just myself being a therapist, how is artificial intelligence looking to change the way we provide mental health services? So what is artificial intelligence? So according to IBM, artificial intelligence leverages computers and machines to mimic decision-making capabilities such as humans do. Some forms of artificial intelligence learn as they go, or they have a set program where they can make and predict information that's given to them based on algorithms or based on the data that's already inputted into the artificial intelligence. One way that artificial intelligence is going to be changing the mental health game is that it is going to be used now as a way to early detect and diagnose. So in our world now, artificial intelligence can be used to analyze large amounts of data, such as people's whereabouts, social media, and also utilizing electronic health records. So electronic health records is something we've already been using. So these are called EHR systems. So this is where if you go to your doctor or if you go to like a healthcare provider, they already have your profile pulled up, or if you have like a login for your healthcare provider, you can see all your doctor's visits and your appointments. So what some companies are doing now, they're utilizing your old medical history in order to determine a possible new diagnosis. So if we think about it this way, it's kind of like an algorithm for electronic health records. So if you go on your Explorer page, for example, if you go on Instagram or you go on TikTok or even YouTube, you can see these algorithms give you a predictability of what you possibly may like based on what you previously viewed. Now, the direction AI is going when it comes to mental health is based on your medical history, such as if you have previous mental health diagnoses, if you smoke or you use drugs or alcohol. What it's doing now is when you input your information on these EHR systems, is giving practitioners such as doctors and therapists a outline of what possibly may be going on based on your previous medical history. So AI is also being used for personalized treatment plans. So AI can be utilized to develop personalized treatment plans based on the individual's unique needs, preferences, limitations, and also their symptoms. Now, this can lead to having more effective treatments and better outcomes for patients. So, for example, there's different criteria that meets schizophrenia as opposed to bipolar, and there's different criteria that is met to say if somebody is more anxious or they're more depressed. Now, what AI looks like is utilizing is some of this information based on the diagnoses to help develop a treatment plan. So, treatment plans, what it usually looks like is you are giving goals that you're utilizing in treatment. So, an example of a treatment goal is I want to reduce my anxiety from daily to maybe 2 times a week, but ultimately trying to get it down to zero. Now, what it looks like the direction that AI is going is they're going to be taking some possible interventions to help individuals reach that goal. And I've already kind of seen this happening before where some electronic health record systems, they already automatically generate certain treatment goals. And many times the therapist will go in there and alter the goals based on what the client is in need of at that time. So like the example I was using earlier, if a client is saying, I want to reduce my anxiety from daily to 0 times per week, The therapist will go in there and usually say, how is this person going to meet that goal? Now, it looks like artificial intelligence is kind of taking some of that information as well too and inputting how can this person reach that goal based on what they're previously telling them. So another way artificial intelligence is changing the mental health game is the utilization of these chat bots and these virtual assistants. And I know this is something that is not new at all either. Like there's been a lot of new platforms for mental health that have been utilizing the chat bots and virtual assistants. Now, one benefit of this is that people can have access to getting mental health services 24/7, right? And it can also make up for this gap that we have in our mental health profession because there's honestly not a lot of therapists out there. And we essentially need more therapists. So it looks like even these chat bots and these virtual assistants are trying to fill the gap that is needed in the mental health profession. Now, I will say, just in my personal opinion, there are some limitations to this because if you are in dire need and you're talking to an algorithm or artificial intelligence, that may not be the best solution, especially if you're in a crisis. So I foresee this being a huge issue because if we're utilizing this for everything or just to fill in the gap instead of like actually hiring people that can assess and can move forward and treating people, then that can most definitely be a huge issue. But also, again, it does give access to mental health services or maybe initiate mental health services for folks that don't have access to it right away. Which leads into my next point is it improves the access to treatment. Now, since 2020, I know a lot of folks, just including myself in my practice, have done virtual therapy. I know before that, it just wasn't the thing. Folks are now able to get therapy and services without having to actually go to a physical location. So, the improvement of access to mental health services through artificial intelligence can be helpful because it opens up a gateway for people to get services initially. For my personal opinion, it shouldn't replace a therapist. But for example, if you're going on a website and they have a chat box and it's 24/7 and you kind of talk to it or you initiate that conversation, maybe it can be a good follow up to maybe get a sooner appointment or schedule an appointment with the therapist and you don't have to go through third parties or go through your insurance and let that AI do all that work for you. That's where I really see the benefit of it is like initiating how we can access mental health services instead of replacing therapists. Now, I feel like artificial intelligence can be a good asset to the mental health field when it comes to overall access to care. Because let's be real, it's easier for us to hop on our phones or hop on an app and not have to drive somewhere or be on hold to talk to somebody. And there's somebody that we can initiate this conversation with about getting access to services. And if it's through AI, I can see a huge benefit in that. So I feel like, again, it's good for the initiation of mental health treatment. Now, let's talk about when you're actually in treatment, because there's recently been a lot of surveys that kids are feeling a lot more comfortable talking to artificial intelligence instead of talking to humans or an actual live person because there's no judgment when it comes to artificial intelligence. There's not any judgment or any shame in talking to artificial intelligence, as opposed to if you're talking to a live person, there might be some judgment or a facial expression or something that might be said that might turn somebody off, such as like a young adult who's new to therapy. Even in my personal experience in going to therapy, I had to change my therapist because I feel like they weren't really serving my needs and they're being really judgmental with the things I was sharing with them. So I can totally understand when folks are saying that they might feel a little bit more comfortable talking to artificial intelligence for sure. Now, is AI going to replace therapists? I feel like at this present moment, it's not going to replace therapists. But I will say this, I don't know what the future is going to hold, and I don't know what people may prefer in the future. So, for example, if these kids are saying they feel more comfortable talking to AI, these kids are soon going to be adults, right? And these adults, they probably will feel the same way they did as a child because it gives them a form of familiarity. You know what I mean? So, only time will tell. I always feel like in our profession, the human connection is the biggest thing you can get from therapy, is really talking to a live person. Emotional intelligence is more valuable than artificial intelligence. So that's why I feel like it's not going to replace us right away. But I don't know what the future may hold. And it's nothing to be scared of. Therapists may feel like they may be replaced by artificial intelligence, but I always will feel like there's going to be a need to talk to an actual live person. That's just my opinion. There may be people that prefer not to, which is perfectly fine. That's where AI may come in for them and it may work for them. But there's going to be folks that's always going to want to talk to a live person. There's even folks now that don't want to do virtual therapy. They'd rather talk to somebody in person. So until artificial intelligence catches on with the emotional intelligence, and I feel like that, that may take some time. Therapists, we're not going anywhere anytime soon. But I will say, therapists, we need to be up to game with what's going on in the artificial intelligence world. We need to be informed and we need to utilize artificial intelligence to our benefit. There's something we can't be ignorant of, we should be scared of, but we should embrace what's going on and be able to utilize artificial intelligence as a tool as opposed to seeing it as a threat. But that's it for this video. Thank you guys for tapping in. Again, don't forget to like, share, and subscribe to this channel. And let me know what you guys think when it comes to artificial intelligence and mental health. Again, my name is Terrence, the therapist. Y'all take care. Peace.